Hi, this is Agape Crane, and I'm just wanting to submit my midterm video reflection. Um, so it's been a really interesting few weeks. I guess we're going toward a month now, not quite. Um, but yeah, uh, so I'm just actually going to make this easy and go down the list here. So, reviewing goals from my last reflection, I really had noted that the big thing is I really wanted to keep working on skills, um, IVs, labs, Foley's, positioning patients, like all these basic things. So I do feel like I have improved with those. I think those were, I don't want to say met because you can always use more practice, and especially as a new student can always continue to improve. But I do feel like I have a lot more confidence, especially getting labs, sticking people, quote unquote. And my dog is coming to see us, so if you see him, there he is. Hi, Jack. Um, and then also with Foley catheters, I definitely feel a lot more comfortable with the whole process of doing those, which is a good thing because they're an essential part of women receiving epidurals, since they don't have their legs underneath them, so to speak, once they receive their epidural. So, all in all, I feel good about my progress. Now, for new goals, my big thing is to really start under not understanding, but walking women through receiving their epidurals. So, being the one to prepare the patient, educate the patient on what's about to happen, also to provide the provider, whether it's an anesthesiologist or a CRNA, with the information they need, like platelet count, um, and also to do the timeout before the procedure. I was able to start that process of educating a patient by myself and preparing her. And my nurse, of course, was there with me, making sure, and she had to walk me through the timeout. I was a little surprised by that. So, my goal is to really be able to kind of handle that and interact with the provider in a professional way, independently, and of course, with my preceptor, looking on. Um, yeah, so that's one of my big things. The other thing is really to start to get more of a grasp on the OR component of labor and delivery, because it's something that I haven't had a lot of exposure to, and certainly not any background virtually. So I think there's a lot there that I need to master, in terms of um, prepping the patient, positioning the patient on the surgical bed, um, educating the patient regarding what will happen. Um, what else? Oh, assisting with instrumentation and supply counts with the tech. Just all these little details that are really important. Um, so that's what I really want to focus on in this next piece. So, um, with those goals in mind and having done the review, I'll move on to the next reflection questions. And let's see, I'll just go down the list, questions 1 and 2. So, describe the patient care situation this week in which the patient care was unfamiliar to you. And actually, it's number 1 and 3, excuse me. Describe a new pharmacological intervention in which you were not familiar. So, this is kind of, they both dovetail together. I had one patient who had both of these. So, the first situation, to answer number 1, is that the patient came in with signs of preeclampsia, but also pregnancy induced hypertension is what it was being identified as, but early signs of preeclampsia, as well as having an LGA baby, so a large for gestational age baby. They were estimating that the baby was almost 9.5 pounds at 37 weeks, so quite large. So that was, excuse me, sorry about that. That was one situation that was unfamiliar to me. I had never encountered an LGA baby. I'd seen small for gestational age babies, but not a large one. And when they're large, it's a whole different set of things to consider, and that may have to go on. So with that, we ended up actually having to do a C-section, so that was some good early exposure for me to the OR, and that's when I really realized I need to focus on that and to make sure that I, start to feel comfortable in that environment as well, because that is a critical and fortunately or unfortunately all too common aspect of labor and delivery, is cesarean deliveries. So that's one. And then also with the same patient, there was a pharmacological intervention that I had never been part of or seen before, and that was a Cervidil placement. And Cervidil was placed, it's a drug that goes near their cervix to help ripen or soften their cervix and hopefully help it to move more anteriorly so that they can induce labor. Very interesting drug. It looks like a piece of like Trident gum that's on a rope, like on a string, on a flat string. And the nurse actually places it internally near the cervix. Obviously a very uncomfortable thing for the women to do, for the women to experience, but very fascinating to see. I'm really glad that I was there for that. I had learned about both Cervidil and its cheaper friend Cytotec, but had yet to see either of them go into play in real life. So, and it did help my patient to prepare for labor. It did soften her cervix, but unfortunately it did not help with the dilation, only because the baby was so large and had not descended to place pressure on the, I guess you would say, the posterior side of it to help it dilate. So, hence we eventually, the next day ended up in a cesarean delivery. So yeah, those are my two reflection questions. Placement of a drug used for dilation, and then a new pharmacological intervention that I had never seen before. Okay, I think that is all I have for now, but I look forward to giving you my final report on our next reflection. Thanks.